This bone tutorial is on the cervical vertebrae in the large animals. So here you can see I have some cervical vertebrae that are lined up. They're on a rope to kind of keep them together. And so we have the atlas and the axis, which are C1 and C2, and then C3, 4, 5, 6, and 7. So they're just lined up in order here, so I can point to a couple of things on there, but I'm also going to use this isolated C3, this is a C3 vertebrae, and point to some of the different processes that you need to know. So first of all, the general plan of a vertebrae is that it has a body, which is the base. So if you're looking at it at this direction, this would be the body. So you have the body here on the bottom part, so it would be ventral, and it's kind of the base of the vertebrae. And then you have an arch. So the arch is this part here, would be the arch. So the top part, the dorsal part, would be the arch. And you can see it's kind of arching inside, and so that's the arch. Now on the cervical vertebrae, they don't have a very big spinous process. We'll see other vertebrae that do, but cervical vertebrae do not. They have a very low spinous process, but this would be the spinous process. And here you can see they're very low on these cervical vertebrae. Then you have a cranial and caudal articular processes. So you have cranial articular processes and caudal articular processes here. So here you can see they're articulating with the other vertebrae. So you have caudal articular processes articulating with the cranial articular processes of the next cervical vertebrae. Then we have some holes to identify. So you have foramen. A foramen is just a hole, and so foramina is plural. Here you have, I'll just put it through the side here, transverse foramen. So these two holes that you see on either side of the body are the transverse foramina. So transverse foramen is 1, transverse foramina is 2, or more. Then we also have the lateral vertebral foramen. So we'll move to the atlas and the axis, where we'll see on the atlas, so the atlas, well, I'll pick up this atlas because it's separate and I can show you. But the atlas doesn't actually have a body per se. It has a dorsal arch, so this would be the dorsal arch, and a ventral arch. So it's just made up of two arches, a dorsal and a ventral, and it does not have a body. So here's the atlas on this specimen. This is the dorsal arch. Then going through the middle, you have this vertebral foramen, and all of the vertebrae have this vertebral foramen, and put together, the vertebral foramen allow passage of the spinal cord through the vertebral canal. So it's kind of where the rope is in this specimen, would be traveling through the vertebral foramen and also through the vertebral canal because it's extending the whole way. But the hole is the foramen, and then the canal is the whole thing all the way down. Okay, then we also have in the atlas, we have the lateral vertebral foramen. So the lateral vertebral foramen is here. So it's this hole, and then it's a little bit confusing because there are two holes right there. So one is the lateral, so here's the lateral vertebral foramen. And then if you kind of tilt it, you can see there's another hole here, and that's the alar foramen. So on this one, lateral foramen is more dorsal, and then alar foramen is more lateral. So lateral foramen, alar foramen, both in kind of the same area there. Then this one is a transverse foramen right here on the side of the atlas. Then on the axis, so the axis is C2 right here, and the two components that are a little bit different about the axis is the spinous process is larger. So you have a spinous process on the axis, and then you also have a dens. So dens is the protrusion off the front here. So dens right there. And then I also have an axis from, it looks like an ox probably, because it looks quite different than this, which is an equine. So this is the spinous process on the bovine, and then the dens is a little bit shorter on that axis. So here on the cervical vertebrae on the rope, I just want to point out in between each of these vertebrae, there's an intervertebral foramen. So you have, here's an intervertebral foramen, and here, and here, and here. And they're in between the vertebrae. So you have each vertebrae joint, so each set of vertebrae have an intervertebral foramen in between.